Hi, my name is Brittany Miskowitz, and this is the recording of my full head-to-toe assessment for Nursing 612 with Maryville University. This is my volunteer, my mother, Lisa. So I am going to begin with the head. I'm doing a visual inspection. I'm looking for anything abnormal, any wounds, bumps, lumps, any asymmetry. It appears to be symmetrical. The eyes are symmetrical, the ears are symmetrical. I'm going to go ahead and palpate the entire head. While I'm here, I'm going to feel the hair for evenness of texture, distribution. Is it too dry? And that actually feels very nice and healthy. I'm going to palpate the facial bones for any abnormalities or asymmetry. And that all appears to be good. I am doing a visual inspection of the eyes. I am looking at the eyelids, the eyelashes. They all appear to be nice and healthy, symmetric, and intact. I'm going to use my pen light to get a little bit better look at the sclera, which is white, clear, no drainage. And actually, while I'm here, I'm doing a pupillary response, and both of the pupils are perla. So next, I am actually going to have you look at the tip of my pen light and just follow it with just your eyes. Don't move your head. All right, and that is all completely normal, a tiny bit of nystagmus, but that is to be expected in anyone. Next, I am going to have you do the cover and cover test. So I want you to look at a point straight ahead, and I would like you to cover your right eye. Okay, and now cover your left eye. Put this, yeah, with your left. That's fine. Okay, that's good. We're going to go ahead and do a quick near vision screening. I'm going to have you hold this in your hand, your right hand, and cover your left eye and read as far down as you are able to.
958742843. 958742843.
Okay, and this patient does wear glasses. Okay, now while we're here, I'm going to have you do a few things to test her cranial nerves. Can you squeeze your eyes really tight? All right, and open up. Wrinkle your forehead up. All right, that's good. Now smile, relax. Can you stick out your tongue? Okay, and can you puff out your cheeks? Okay, and all of those appear to be intact. Next, I'm going to go to the ears. I'm doing a visual inspection. They are symmetrical. There are no wounds of any kind or asymmetrical aspects to them. I'm palpating. They are nice and soft and intact. Cartilage is intact. I am going to go ahead and use my otoscope, and I'm just going to look at the ear. Just keep your head still for me. The ear canal is wax-free, and the eardrum is intact, pearly gray, and that is true bilaterally. I'm going to do a quick hearing check. First, I'm going to start with the Weber test, and I just want you to tell me if you hear this more on the left side, right side, or both.
Both.
Okay. Now I'm going to place this behind your ear, and I want you to tell me when you stop feeling it. And then when I move it to your ear, tell me when you stop hearing it.
Stop feeling. Stop.
Okay.
Stop. Stop.
Okay. So the ear conduction is greater than the bone conduction, which is as it should be. While I'm here, I'm just going to go ahead and palpate the lacrimal glands, and they are good to go. Next, I'm going to go to the mouth, Doing a quick visual inspection of the oral cavity. Can you go ahead and open your mouth for me? The mucosa is pink and moist. There are no lesions. Can you move your tongue to the left side? To the right side? Okay. And the tongue looks good. I'm going to go ahead and get the patient to do ah and then elicit a gag reflex. So can you open your mouth? Ah.
Ah.
And I'm going to elicit a quick gag reflex. All right. And that is intact. I'm sorry. I know that is uncomfortable. All right, then we are going to go down to the neck, and I'm actually going to start with the lymph nodes. Palpating the occipital, the preauricular, and the postauricular. I'm actually going to come down the neck. So, mandibular and the submental, and I was unable to palpate any of them, which is normal and to be expected. At the neck, I'm going to go ahead and do a visual inspection. The thyroid is not enlarged, and I do not see any jugular vein distension. One thing I will do is I'm going to stand behind you. I'm going to attempt to palpate the thyroid, and can you swallow for me? Okay. Thyroid was not palpable, which is normal and to be expected. I'm going to have you move your head forward and back and left and right. All right. And then keep your head forward, and I want you to turn your head to push against my hand. Okay? Same here. All right. And that is good strength. And did you have any pain when you did any of that? Okay, wonderful. Then we are going to go to the thoracic cavity. I'm actually going to start in the back. I am doing a visual inspection. It appears to be symmetrical. Can you take 2 deep breaths for me? And 1 more. And there was equal expansion. Can you say 99 for me?
99. 99. 99.
Okay. And I didn't feel any abnormalities with that. I'm going to go ahead and listen in the back while I'm here, from side to side, and ensure that it is the same on both sides. Take a deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. All right, and that all sounds normal. While I'm here, I'm going to do the lateral. Can you take a deep breath for me? Deep breath. And that is normal from side to side as well. Now we will go ahead and go to the front. And the patient is breathing comfortably. No labored respirations, and they appear to be normal in rhythm. I'm going to go ahead and feel for any heaves, which I do not. I'm going to go ahead and listen to the lungs in the front. Just breathe normal for me. And I'm going to go ahead and start listening to the cardiac sound. I'm going to start with the aortic. And the pulmonic. Going down to Erb's point. And then I'm going to try to get to the tricuspid area, which is a little bit harder on women. And then mitral area. Alright. And one thing I did forget to do in the back is I'm just going to go ahead and percuss and make sure I don't hear, I hear evenness on both sides. So. Okay. All right, so now we're going to move to the abdominal cavity. So I'm going to go ahead and ask my patient to lie down. The first thing I'm going to do is actually inspect the abdominal cavity. Get down beside it. It is nice, flat, symmetrical. And then I am actually going to go ahead and listen to the vowel sounds in all four quadrants. Okay, and all four vowel sounds are active. I am actually going to go ahead and percuss the liver border. I'm going to attempt to percuss the splenic border. Alright, I'm going to do some light palpation systematically just to see if I feel anything abnormal. Alright, and so next, in an attempt to palpate the liver border, I'm going to place my hands right below the rib cage, ask the patient to take a deep breath in, and exhale. Okay, I'm going to go to the other side for the spine. Alright, and take a deep breath in, and exhale. Okay, now I was not able to palpate the spleen, which is normal. I'm attempting to do deep palpation for the kidney, which I have the left one. And deep palpation for the right. And that appears to be intact. While I have the patient laying back, I'm going to go ahead and just test their spine by lifting their legs up and making sure that there's no pain or discomfort. So just let me move your leg. Is that okay? Mm-hmm. Right. We're going to do the left leg. All right. So I'm actually going to have you stand up, sit up. Okay, and one thing I did forget to do earlier, I forgot to do the nose when I was with the head and the neck. So visual inspection of the nose is symmetric, the septum is midline, and I'm going to do a quick check of the nostrils. The mucosa is nice and pink, and I'm also going to have you take a sniff, and both nostrils appear to be patent. Next, I'm going to observe the upper extremities. Okay, so separate your hands. The skin is intact. It is the appropriate color. Just a normal scratch. No lesions or wounds that are draining. The capillary refill in the bilateral hands is less than 2 seconds. I'm going to go ahead and feel for your radial pulse. It's 2 plus. 2 plus. I'm going to get the brachial. Okay. And those are 2 plus as well. Now I'm going to go to the lower extremities. I'm doing an inspection. The muscle appears to be even on both sides. Can you push out your left leg for me? Okay. Push out your right. And they appear to have equal strength as well. I'm going to go ahead and check my pulses. The Dorsalis, pedis, and posterior tibial are both 2+.